understand what we are discussing, you can directly apply this understanding in your exam, and you can solve even without reading, okay? Because all questions are derived from our discussion. If you just know how to apply yourself for anything, that will make your life very easy, and your preparation time will decrease really, okay? Because everything is not written here, it's all on our interaction which is based. All right? So please be attentive. I think we have done the major pathways in the form of the sensations which are carried. We talked about the comparison of ascending pathways, dorsal column system and the ventrolateral or the anterolateral systems, okay? And we know the major sensations which are carried by these systems, okay? Let us have a look. Look at that. Pain temperature pathways, okay, it's an animation. You are starting from dorsal root ganglion. The pain fibers are coming. Pain, I think you are done with Dr. Majdi now. Okay, so you must be comfortable about the sharp pain and the dull pain, or the fast pain or the slow pain you call it. Okay, sharp pain, A delta fibers, and dull pain, type C fibers. Okay, slow pain, which is C fibers. Okay, both pains are carried in the same tract. I told you, all pain is being carried in only one tract, and that is lateral spinothalamic tract. Okay, without any doubt, this is the tract, and this is the most important sensation which is traveling. Well, pain is really regarded as one of the most important sensations. Why? Protective. Pain is a blessing from Allah, because if pain is not there, you will not realize that there is any problem, any damage or any disease going on in one area of the body. So if the pain is intact, it's kind of an alarm going into your system that something is wrong, and definitely you will seek some advice or some treatment about that. So pain is very, very important sensation. So the tract of the pain and temperature actually is the most important tract of the ascending system, pain temperature tract. Along with that, you have the crude touch and pressure, which is traveling in anterior spinothalamic tract. So if I say, give me the one most important collective system of the spinal cord which is carrying your sensations, what will be your answer? One most important collective system of the spinal cord, ventral. Okay, in the ventral, if I say no, give me more specific answer for the spinothalamic will be the answer, because spinothalamic saying, when you say spinothalamic, you are covering pain, temperature, crude touch and pressure. Yani it's a bundle of your sensations, a group of sensations in one word only, spinothalamic system. Khalas, isn't it? So spinothalamic becomes the most important system really, okay, as far as your awareness or your knowing of sensations are concerned. Please, spinothalamic system. On the other side, dorsal column system is carrying your fine touch, darajat of pressure and temperature, proprioception, vibration, and sensations of fullness, stereognosis. You have all done it, isn't it? Okay. Well, if you are comparing these two systems, and if you have damage in these two systems, okay, sometimes there is damage in the dorsal system, sometimes there is damage in the spinothalamic system, in the ventrolateral area of the spinal cord. What do you think if the spinothalamic system or the ventrolateral system is damaged, and in comparison dorsal column lemniscal system is damaged, which one will give you a bigger trouble? Spinothalamic system or the dorsal column lemniscal system? Okay, yeah, because you can live without. Okay, if your touch is decreased and you cannot really identify exact area of the touch, it does not really matter. Life is still there. Okay, the person can live. If you don't feel vibration very much, doesn't matter. Quality is affected, isn't it? If you are having proprioception problems, you will have a difficulty. You will have a difficulty in walking and standing and changing positions, but still the life can be managed with care. Okay. If you are not having stereognosis, it doesn't really matter very much. You will be disturbed by many things in your common life, but still, it is not a serious damage to your life, isn't it? On the other side, if your spinothalamic system is damaged, imagine what will happen. You are losing pain on one side. If one side is damaged, you are losing pain, okay, on that side from where it is coming. If you are damaging temperature and crude touch and pressure together with the pain, this group, okay, will give you a big blow. A quantity of your sensations, not the quality, but the quantity of your sensations, it is gone, isn't it? So if I want to choose the words, which one is a bigger loss and which one is a smaller loss? Spinothalamic loss is a bigger loss. Do you agree with that? And dorsal column loss, it is a loss, a significant loss. I'm not saying that, but as compared to that one, it is a lesser loss or it is a smaller loss, okay? So if I say, well, I use a term, there was a major sensory loss in the system. What do I mean by that? I say, oh, this person has a minor sensory loss on the right side of the body. What do I mean by that? His dorsal column is damaged, okay? So look at the words I am using, major loss and the minor loss, because first you need to understand what is the meaning of major and what is the meaning of minor, okay? How will you relate these major and minor words with your tracts? Is it clear? Okay, so major sensory loss and minor sensory loss, or the bigger or smaller loss, and you can guess why you know that. Are we clear about that? Okay, so always pay more importance to your main sensations, major sensations, and your major sensations are traveling in which area of the spinal cord? Yes, I'm not asking that the understanding of the sensation or the details of the sensation or the quality of sensation. If I say, no, I want the quality, where can you have more discrimination, best quality, best understanding? What will you say? Dorsal column. Understanding is better. Differences are better. Quality is better. But overall loss, it is more for, overall loss for this one is minor, and for the anterior spinothalamic and lateral spinothalamic, it is the major loss that you are having. Clear, Shabab? Okay. Look at that one. We are starting from, no, this is about unconscious, very quickly. We did this slide. Let's have a quick go, okay? Look at this slide, the same arrangement, a pathway, a spinal cord pathway, starting from outside, very quickly. Okay. You see, the pathway is going from skin, dorsal root ganglion. Just identify what I'm saying in the picture. Look at the picture and identify. You can see the skin where receptor is موجود. You can see the peripheral process, dorsal root ganglion, central process which is going into the spinal cord, synapse number 1, okay, in the pathway in the spinal cord, crossing over to the opposite side, and the tract is going up, second synapse in the thalamus. Yes, and then the fiber passes up, which is the third order neuron موجود in the thalamus, the fiber or the axon of the third order neuron going up, and it's cortex. It's a pathway. Well, this pathway, if it is first order or the first synapse موجود in the spinal cord and crossing over is occurring in the spinal cord, is this pathway showing you a representation of ventral spinothalamic system, means ventrolateral system, or the dorsal column system? It is giving you an idea about the ventrolateral column. This kind of arrangement is موجود there, okay? You can identify that very easily. Now, let us have an application. Now, if you are damaging the pathway before it crosses, if you are damaging the pathway here in this area, you damage this one here, what will happen? You will have a damage which is ipsilateral, okay? If outside the CNS is damaged, okay, a nerve is damaged which is coming, you will have the same sided loss, you know that, okay? If inside the, as you enter, you damage this area of the spinal cord, or before crossing this area, what will happen? Still you will have the ipsilateral loss, okay? But if you are damaging this side, you are cutting this side or damaging this side. Okay? Yeah, you are damaging the opposite side of spinal cord, but you will have a problem on the opposite side in the body because now the fibers have crossed in the spinal cord. Okay? So it's a contralateral loss in the body. Loss of sensations, contralateral loss. Okay? Spinal cord damage on the left side, left half of the spinal cord is damaged, right side of your lower body will be affected because it's very simple, crossing over has happened. Clear? Okay. Okay. So it's contralateral. All right. When you are crossing the pathway, when it is crossing at this level here, if you are crossing the path, damage is here in this area, then you will have a confusing defect really. Both sides may be variably affected. How much is the damage? So it involves both sides because the crossing over area is not really, you cannot assess that is this side more damaged or this side more damaged or where is the damage. So there will be a deficit on both sides really, okay, in that case. So it's simple. Okay. In the beginning, if the nerve is damaged or at the point of entry, you are damaging ipsilateral. If the crossing has occurred, contralateral, opposite side. And if it's at the level of crossing, then usually it affects like this. Okay, this is ipsilateral here if you are cutting it. If you are damaging this area or thalamus area, then what will happen? It's a contralateral loss. Okay, even if you damage the thalamus area, because now it will go on the same side. Okay. Okay. Same thing, nothing special. You need to remember the basic principle. Okay. Now you tell me, you are damaging the dorsal column, okay, in the mid-thoracic region, for example, mid-thoracic region, you are damaging the dorsal column. There is an injury, there is a stab wound, or there is an accident, or the person is driving over the highway and there was a severe accident on the highway which affected the fracture of the vertebral column, and that fracture, a broken piece of the bone, it cuts the dorsal column really after breaking, okay, one part of the dorsal column in the mid region. So one dorsal column is damaged, for example, okay, on the right side, okay, here on the right side, one dorsal column is damaged at the mid-thoracic ribble taqriban, for example. Now, what is your idea? There will be a major or the minor loss? Minor loss. Same side or the opposite side? Same side. Loss will be on the same side and it will be of the minor loss. And when I say minor loss, you will have a list of some sensations. Okay. Fine touch is gone and vibration is gone, stereognosis is gone, like this. And you will quickly develop a list in your mind like this. Okay. So this is how you apply simple things, that what kind of loss will be there, which side is affected really. Okay. Hello?